Good day, and thank you all for joining me once again as we take a look at exploring some of the wonderful and amazing content available through Primal Pictures. Today we'll be hopping over into the Clinical Specialties title by taking a look at some of the more niche content available through the Audiology module. Kicking things off, for those of you who aren't familiar with the subdiscipline in medicine, audiology involves both the management, treatment, as well as diagnosis for both hearing and balance disorders in both children and adults. For those of you who have made use of the anatomy and physiology title, this overall user interface may seem quite similar or familiar in this case. For today, we'll be going ahead and taking a look at how to navigate this homepage, as well as take a look at some of the specialty content specific to audiology. Over on the far left, similar to the anatomy and physiology title, you'll have those various menu options. In the center, you'll have your interactive viewing pane with your interactive 3D model. And over on the far right hand side, you'll have those various learning objectives as well as the associated explanatory text. For today, let's go ahead and jump over into the microanatomy of the cochlea. In this case, as you'll see, you'll have your interactive 3D model with those little over labels. And for any structure that you do select, and then highlight that appropriate structure, as well as provide you with the associated name. We're not going to be taking a look at providing you with a full lesson about the microanatomy of the cochlea, but for these different learning objectives, it'll then help guide your learning experience as you progress through the specific topic. And in this case, if I go ahead and minimize those learning objectives, we're then able to use the explanatory text alongside our interactive 3D model in order to gain a more holistic understanding about this content that we'll be taking a look at. And for today, if we go ahead and select our main model, it then pushes that associated 3D model to our center panel, and we're then able to get a better understanding about the organ of Corti and its positioning in relation to the cochlear duct as well as the scala media. Now, as we move through and complete each of those different learning objectives, we'll then be greeted with a few interactive learning activities. These learning activities do vary quite a bit in terms of their type of questioning, but in this case, we'll be focusing on our identification of some of the structures for the microanatomy of the cochlea. Similarly with the anatomy and physiology title, many of these interactive 3D models also come accompanied alongside authentic histological images, and this just further helps relate our understanding of this information towards a more practical or clinical standpoint. Now let's go ahead and hop over into some of those different menu options. Similarly with the anatomy and physiology title, we have our index, which allows us to search for any specific piece of content throughout audiology. If we wanted to quickly access some of those different interactive learning activities, we can then also find that once again over at the little beaker icon. And since we took a look at the microanatomy of the cochlea, let's go ahead and jump over into that, for example. In this case, we can see there were two different interactive learning activities associated for that topic. Taking things one step further, we then also have those different quizzes. Now toward the end, once again, we'd also get a full comprehensive quiz, which encompasses every single question across each of those different topics for audiology. This information wouldn't be quite relevant if we couldn't apply it towards a more practical setting. And this has been achieved once again through both the clinical, aging, as well as case studies information. Now, for these various clinical examples, what you'd be provided with is a full comprehensive overview encompassing both causes, symptoms, diagnosis, as well as treatment. And in this case, we'd also be provided with an accompanying image showcasing the overall presentation of a acoustic neuroma. And then, as we know, there are those associated changes that do occur to our anatomy and physiology as we age. And this just helps further relate our understanding about the specific changes, which result in both hearing loss, as well as an alteration in the sense of balance or equilibrium as those specific changes do occur to our anatomy and physiology. And then lastly, forcing us to think even more critically, we then have those different case studies. And this just helps force us to think more critically about how to apply this information and test our understanding about the anatomy and physiology of hearing and balance in relation to various clinical cases. Similarly, with the anatomy and physiology title, we're able to save and favorite content. Now, in this case, if I was logged into my personal profile, I'd then be able to save this content to my cloud and access it from any device at any time, be it my personal smartphone or personal device. Now, in this case, because I'm not logged into my personal profile, any information that I save or favorite will simply be stored to my browser, meaning I'd only then be able to access that saved content from the original device that I previously saved it on. And then lastly, some of those other functions that we have over in the menu bar simply allow you to share a link with any specific piece of content to some of your fellow colleagues or students. The ability to then embed this content over into an institution's existing learning management system, as well as the ability to save this content simply as an image, topic text, or topic PDF. Now, once again, as we saw over in the anatomy and physiology title, it would be highly beneficial to save this content as a topic PDF because it then merges the explanatory text alongside some of those interactive 3D models in a 2D format. And then lastly, we just have some different menu options which allows you to modify your user interface. Now, I hope you all enjoyed this little crash course, taking a deeper dive over into audiology, and I implore you to go ahead and explore this title and take a look at some of the specialty content specific to audiology, as well as some of those other subdisciplines within medicine. I hope you all enjoy your time using Primal Pictures as you make learning come alive.